It was Bateman who gave the names and detailed descriptions of a number of dermatological diseases, including urticaria, alopecia areata, erythema multiforme, and molluscum contagiosum. The work of Willen and Bateman influenced many physicians, such as Thomas Addison and Laurent Theodore Biet, who later introduced their methodology into French medicine. It was Robert Willen and Thomas Bateman who became the first physicians who came to the conclusion that acne is the result of a malfunction of the sebaceous glands. True, they could not say what exactly is the trigger for the development of the disease in some cases or others, but even modern physicians do not know this for sure. The reason may be heredity, hormonal disruptions, infections, malnutrition, excessive stress, and more. Research continues, and answers to all questions of interest to humanity are not far off. Exactly 120 years ago, in 1903, a color-illustrated collection of dermatology compiled by the Scottish dermatologist John James Pringle was published. In this collection, various skin diseases were described, as well as data known at that time in nosology. To this day, this collection helps physicians both in their education and in further research on skin diseases. Its pages presented all Pringle's knowledge he collected during his travels to Dublin, Vienna, Paris, and Berlin. Wherever he was, the scientist devoted time to learning. In Vienna, he studied dermatology with renowned doctors like Ferdinand von Hebra and Maurice Capozzi, and in Paris with Jean-Baptiste Émile Vidal and Jean-Alfred Fournier. In 1882, John Pringle settled in London and spent the next 32 years of his life working as a dermatologist at the Middlesex Hospital in London. In all the cases he encountered, Pringle described in detail. If they raised questions or doubts, he previously presented them at meetings of the Dermatological Society in London. Thanks to its thoroughness, many references to acne have come down to our time. Among other things, Pringle writes that the causes of acne are poorly understood, and there are many pathological processes that contribute to the development of the disease. Besides, he mentions that the formation of comedones is often facilitated by a specific predisposition to seborrhea, and the assignment of bacteria found in the purulent contents of pustules to a specific group of pathogens remained controversial. Disputes about the main causes of acne began 200 years ago and continued throughout this time. Most often, doctors agreed on three main prerequisites for contraction and the development of the disease: pore clogging, increased sebum secretion, and bacterial colonization of the sebaceous glands. James J. Leyden, distinguished lecturer in dermatology at the Medical University of Pennsylvania, bows down to a version of the bacterial factor and acne, and therefore, in the treatment, he recommended primarily using antimicrobial drugs, for example, isotretinoin. Leyden also introduced his own algorithm for prescribing antimicrobial drugs. According to this algorithm, all patients should start acne treatment with a combination of benzoyl peroxide plus retinoid and be observed for 3 to 4 months. Women not responding to standard dose treatment should receive spironolactone, 100 mg to 200 mg daily, an oral contraceptive, and the highest dose of isotretinoin they can tolerate without side effects. Men who do not respond to therapy should receive the highest dose of isotretinoin they can tolerate without side effects. Leyden also pointed out that some patients taking antibiotics may experience some changes in their mental state, and yet the scientists continue to insist that systemic isotretinoin remains the most effective treatment for severe acne and some cases of more moderate acne. This is the only medicine that helps when other treatment options do not work. His colleague, M.D., who teaches at Thomas Jefferson University in Philadelphia, Guy Webster, fully agreed with this opinion. He added that in those rare cases when antimicrobial drugs do not provide the desired effect, the attending physician should find out if the patient is complying with the regimen and consider increasing the dose. Webster also warned about the side effects associated with the use of such medicines, for example, about exacerbation of inflammatory bowel diseases. At the same time, in his monograph, Guy Webster honestly admits that the causes of follicular hyperkeratosis leading to the formation of comedones are unknown. At the same time, a senior researcher at the Dachau Medical Center, Dr. Christos C. Zaboulis, was more inclined to believe heredity plays a decisive role in the occurrence of the disease. Parents who know that they suffered from severe forms of acne in their youth are obliged to prevent the occurrence of acne in their own children, he notes in his articles. The American dermatologist Albert Montgomery Kligman also made a huge contribution to the study of the processes leading to acne. It was he who invented the drug Retin-A, a fairly effective remedy for acne. Also, Dr. Kligman discovered the role of retinoids in the treatment of acne and debunked the myth that chocolate contributes to acne. Dr. Kligman was really fanatical about his work, and the results of his activities were appropriate. For example, it was Kligman who became the person who determined the results of exposure of sunlight to the skin. While studying the effects of retinol on acne for Johnson & Johnson, Dr. Kligman identified its anti-aging properties and in 1996 created the photodamage treatment Renova with tretinoin, which received FDA approval as a treatment for photoaging. In the middle of 1960, he published The Biology of the Stratum Corneum, in which he stated that the stratum corneum of the epidermis is not dead skin, but a dynamic, living, and active tissue. Unfortunately, the activities of Dr. Kligman are overshadowed by negative fame. The fact is that in the 1960s, he tested a complex experimental program on the prisoners of the Holmesburg prison. He tested various drugs on convicts commissioned by the U.S. Army and the Department of Defense. His goal was to create products to protect the skin of soldiers from chemical irritants in war zones. The scientists gave prisoners injections of Agent Orange, an herbicide that was planned to be used for military purposes in order to study its effect on the human body. Test persons fell ill with chronic skin diseases and died in agony. Kligman did not think about human losses. For him, science came first. He later noted, "When I first arrived at the prison, all I saw in front of me were endless acres of skin." Kligman's activities came to an end when almost 300 test persons sued him for chemical burns, blisters, and other experiment outcomes. As a result, Kligman's research in Holmesburg prison became an example of unethical experimentation and was condemned as equivalent to the barbarism and sadism of Auschwitz and Dachau. Nevertheless, Dr. Albert Montgomery Kligman helped science to advance significantly. Thanks to him, researchers have further expanded their understanding of the processes underlying the occurrence of acne. Over time, the pathogenesis of the disease became clear, and today, doctors know the direction in which it is necessary to move for a more detailed study of the causes of this pathology. American actress and model Cameron Diaz has repeatedly admitted that she has suffered from severe acne all her adult life. A Golden Globe nominee with a stunning smile, Cameron has first-hand experience with oily skin, enlarged pores, and rashes. Once, she admitted to reporters that the rashes on her face sometimes became very aggravated, and after such outbreaks, deep post-acne marks remained on the skin. During such periods, the actress needed a lot of time to disguise them. Fortunately, acne did not affect Diaz's career in any way, and her self-esteem too. To date, acne remains one of the main diseases for which U.S. residents turn to dermatologists. Besides, people suffering from acne spend significant financial means to combat this health condition. They fill over 1 million prescriptions each year for drugs worth hundreds of millions of dollars. One of the sisters of the Kardashian family, Kendall Jenner, is also the owner of Not the Best Skin. The defect is so obvious that journalists have repeatedly paid attention to it. Kendall herself does not hide the fact that she suffers from acne. At the same time, she carefully masks the rash and tries to treat it in every way possible. But in this fight, she is losing so far. Acne requires a long and complex treatment, which greatly contributes to the strengthening of this area of the pharmaceutical business. Along with that, significant financial resources are also spent on surgical and cosmetic correction of defects. British singer Victoria Beckham also suffered from acne. The rashes were so severe that they left visible marks on her skin. Victoria coped with the primal cause with the help of nutritional correction and improved the quality of her skin over time with the help of cosmetology. However, she still tries not to leave the house without makeup in order to hide those bumps that she has not been able to completely get rid of. Today, there are many different treatments for acne. These include alpha-hydroxy acid, anti-androgenic drugs, antibiotics, anti-seborrheic drugs, azelaic acid, benzoyl peroxide, hormonal drugs, keratolytic soaps, nicotinamide, retinoids, and salicylic acid. Acne treatments work in a variety of ways. Some of them reduce inflammation. Others normalize hormonal levels. There are also medicines that destroy Cutibacterium acnes and normalizing both the shedding of skin cells and the production of sebum in the pores. Antibiotics are one of the most popular treatments for acne. However, modern scientific evidence shows that although bacteria provoke acne, they are hardly the main cause of its occurrence. Alongside this, if antibiotics are used incorrectly, there is a risk of developing bacterial resistance, a phenomenon in which bacteria develop resistance to the action of an antibiotic, and over time, its effect is reduced to zero. That is why modern standards recommend limiting the use of antibiotics in the treatment of acne to a short course, and also prescribe not to use them as monotherapy, but to add medicines to them that target not only bacteria, but also other causes of acne. The famous singer Rihanna was not bypassed by acne, and post-acne either. The girl admitted that she failed to cure her skin completely, although her condition improved noticeably over time. But as soon as she experiences stress, sleeps poorly, breaks the appropriate diet, her skin issues return again. Generally, people with acne are advised not to wash the affected skin more than twice a day. Applying a fragrance-free moisturizer to sensitive and acne-prone skin can reduce inflammation. Skin irritation caused by acne medications usually peaks 2 weeks after the start of use and tends to lessen with continued use. Dermatologists recommend using beauty products that say they are non-comedogenic, oil-free, and won't clog pores. Doctors also recommend a low, simple sugar diet for acne. Foods containing simple sugars usually include sweets, fruits, fruit juices, and honey. They are a good source of energy, but their excessive consumption is harmful to health, so it is advisable to limit them. Despite all the existing treatments, acne continues to be one of the most priority diseases of our time. However, doctors are working nonstop to find effective ways to deal with this problem and, importantly, to find options for its prevention. Sincerely yours, Dr. Popmed.